So next we have David Barrett, and David is from the School of Veterinary Science at Bristol University. And David is going to present on
my timing.
Yes, developing a multifaceted, collaborative, practice-wide approach to responsible medicines use on farms. So you're very welcome, David.
Thank you very much. I'm presenting on behalf of David Tisdall, one of my colleagues from University of Bristol who can't be here, hence the two names on the slide, and the rather complicated title, which actually isn't mine. What we're going to sort of talk about today is this practical approach that's been used in our veterinary practice at the University of Bristol. And quite a lot of the sort of procedures that have been done there reflect what our keynote was telling us has happened across the whole of the Netherlands. So this is a much smaller sample, but it's just to show, if you like, it's proof of concept that we can change prescribing practices on UK dairy farms in the way that we would like to. For those that don't know where we are, the University of Bristol Langford campus is just near the River Severn, south of the river, here in the northern part of Somerset. Oops, sorry. So within the practice, we have an ethos, which is about herd health and production management and controlling and really preventing disease. There's a strong emphasis on clinical governance, and we're an undergraduate teaching practice. And as we heard earlier, changing behaviours, established behaviours are difficult. Learning new behaviours or forming behaviours in younger people is much easier. So, for example, if I get in the car and go to start the engine and my children haven't got their seatbelts on, they start screaming at me. When I was a kid, you know, you maybe put your seatbelt on. It's that sort of thing. So we're about teaching young graduates, undergraduates, about what we want them to do in the future, not what is happening out there so much in the present, although that is clearly important. So it's about finding sort of a practice partnership approach that can work towards more responsible use of medicines. We work in a kind of One Health arena. I'm involved in lots of discussions with medics and what's happening there, and we talked about that earlier, and we've got research going on in companion animals, and the environment, and various other things as well. But in the context of today's presentation, it's all about antimicrobial stewardship, and these things over on this side, so responsible use, while improving animal health and reducing total use of medicines. It's not medicines or health, it's reducing medicine use and health, and particularly around the critically important antimicrobials. So there are some sort of paradoxes out there in that there's this concern around antimicrobial use. We know, and we've heard already, that use in the human field is a particular problem. Certainly within the UK, I think we've gone beyond that discussion, you know, is it your fault, our fault, you know, is it the medic's fault? We're all in this, we've all got to be more responsible, and therefore we're working together to improve use. Critically important antimicrobials, again, is something that people discuss, criticize, you know, are they truly critical? Why have the World Health Organization labeled them as such? Not going to go into all that either. For the purposes of today, we're talking about the third and fourth generation cephalosporins, as we heard from the keynote speaker, fluoroquinolones, and the longer-acting macrolides. So when I talk about critically important antimicrobials in this presentation, that's what we're talking about. There's lots of literature out there. There's lots of things being produced by the British Veterinary Association, British Cattle Veterinary Association, both of which members of our group are working with. But, you know, this stuff gets pinned on walls if you're lucky. Whether it gets read is another thing, and whether it actually changes behavior, we're not really sure. And again, we heard a lot about that earlier. Reducing our total use of antimicrobials, and particularly the critically important antimicrobials, is our goal within the practice, and that has been identified by the Department of Health in the UK as a goal in the 5-year strategy there for both medics and doctors. Now, we can argue whether that is going to have an impact on antimicrobial resistance. We can talk about co-selection on plasmids and this kind of thing. We can say what's critical, what's not. But the fact remains, this is simple selection pressure on a rapidly a population of microbes that have very short generation intervals, and therefore it's just a genetic fact that they will evolve in the environment in which they are developing. So if we use less antimicrobials, then we're likely to see less resistance. It's going to be a long time to prove that, but that's our sort of thought process, and that's where we're starting. In the UK, anyway, and in Europe, then the vets are certainly the gatekeepers of all antimicrobials. So it's our responsibility to know how they're used, why they're used, what's happening on farm. In the UK, we've been talking about herd health plans, herd health planning, herd health management, all of these things, but they've largely been focused around quality assurance and animal welfare. And what we've tried to do is redefine that and focus it about responsible use of medicines. And actually, I think responsible use of medicines could be in the centre of this diagram. Because we're looking at herd health from that perspective, opens up all sorts of opportunities for discussions, both about antimicrobials and anthelmintics, which of course don't bother the medics, but are of a concern to us. And when you look at herd health from a medicine perspective, it's really enlightening. So what did our practice do? Well, they had a practice-wide collaborative approach, which was multifaceted, again, very similar to what we were hearing about earlier, and what was focused on improving prescribing practices. And again, as we've heard before, and we will hear again this morning, it's not the farmers that are resistant to change. All right? It's great to see a packed room of veterinary surgeons here, but you're the problem. We're the problem. Okay, we're the ones that are resistant to change. And once all the vets in the practice were on board, which actually in a university teaching practice wasn't very difficult to do, but once all the vets were on board, farmers, given the correct advice and motivation and all the things that we've talked about before and some of the things that Dr. Rare from our group will talk about later, the farmers engaged very quickly. So this was a process that began about 5 years ago with active herd health planning, and building partnerships with our farmers, and then defining first-line treatments and the so-called restricted products, or things that we weren't going to use, as indicated already. And then back in 2012, we ran some workshops. Perhaps in retrospect, they weren't always the best way of communication, because we did sort of talk to people about what we wanted them to do. They weren't as collaborative as they might have been, but nevertheless, the farmers were engaged. And then we changed the policies in the practice. Fluoroquinolone use had already been stopped. And for the record, I'm quite happy for anyone anywhere around the world to quote me when I say this. I do not think we need fluoroquinolones in dairy practice. Right? I wouldn't advocate banning them, because there might be odd occasions when we do need them. But as a general rule, I think they have no place in what we do. I qualified and went into practice over 25 years ago. I didn't have them then, I didn't need them then, and I don't think we need them now. In intramammary use, we've moved away from fourth-generation cephalosporins, and systemically, we also moved away from the third-generation cephalosporin, which has clearly been marketed very heavily with a zero milk withhold type product, towards older aminopenicillins, tetracyclines, those kind of things, and first-generation cephalosporins. And I've been badgering one of the companies here this week to give us another first-generation injectable cephalosporin, because I think we need a little bit more choice in what we can use there. So treatments, we also, when we look at the data in a minute, we also took the treatments for pneumonia as a slightly separate entity from the others, and we moved away from long-acting macrolides towards, or back towards, tetracycline and fluorphenicol. This is a process, it's an iterative process. So the farmers were then given medicine audits, which are not, it's not to kind of hit them with a stick, it's just to know what's going on. We haven't gone down the defined daily dose route. We've just been measuring what's been happening on farms in total use, and I'll present data in total practice level. Now, we've heard already metrics and international metrics are something that we need, but we took the view that if we gathered the data, we could crunch the numbers later, and we can put out from that any parameter that you want in terms of days treatment, milligrams per kilogram, milligrams per litre of milk, whatever you want, as long as we know how many animals, what the animals weigh, what their production is, and how much antimicrobial is being used. We held all farmer meetings and auditing, and we put protocols in place throughout the practice, and in fact throughout all of our clinical facilities at the university. As I say, this is a kind of iterative process. Some of you have seen this diagram before. The bit to focus on is that bit in the middle: responsible use, improving animal health, reducing total use, and then closing the loop and continuing that process year on year, or even week on week, month on month. So what did we measure? Well, we've also measured the welfare and things within the animals, looking at responsible use of the different products. As we've said, we're looking at farm level and at practice level, total antimicrobial usage. I'll not dwell too much on some of these things because time's short, but there are complexities about what you measure, as we've heard already. So results, can be presented in many different ways. What you see here is, I'll get the right diagram in a minute. Most of our treatments are actually systemic antimicrobials for sick cows and that sort of thing, because the prevention of disease is very good. And the treatments using both dry cow therapy and lactating cow therapies are a relatively small proportion. The colours change there, but as I say, there's systemic antimicrobials for various treatments and the treatment of respiratory disease. This is predominantly dairy farms, so it's dairy calves that we're talking about. Total antibiotic or antimicrobial use by class is shown here. There are some classes completely missing from there, such as the fluoroquinolones, and you'll notice that the histogram is relatively flat, so you might think, well, they're using about the same, and they've used about the same year on year. And we'll talk a little bit about that in a minute. The numbers of cows in the practice has actually gone up. So there's a 7% reduction in total use of antimicrobials in the last couple of years. Approximately 10% more cows in the practice. Those of you that are dying to take a picture to tweet and send around the world, I suggest this is the one you want to take a picture of. This is critically important antimicrobial use within the practice, and it's dropped off precipitously, just like we saw had happened in antimicrobial use in the Netherlands. So we can do this, and we can do it in UK practices. All right, so the numbers are there, 80, 90, 100% reductions in some of these antimicrobials. Critically important antimicrobials in lactating cow tubes stopped completely. Okay. In dry cow therapy, again, substantial reductions, and we're not using these products anymore. Now, these farms are not full of dead cows. You know, somatic cell counts are not going through the roof. These cows and these farms are still healthy, and they are productive. We know there's challenges in how we interpret some of these data, but the important thing is, although I've presented fairly high level, this is what the practice does, rather than looking at it at cow level or farm level. This is at the background of an increasing number of dairy cows within that practice. Other challenges exist. I'm a bit worried about these antibiotic numbers. All right? If you just say to somebody, use less antimicrobials, the logical thing to do if they want to use less in mg per kg is to move to a fluoroquinolone, all right? Because it's very, very potent and you can give very low doses. Conversely, if you move the other way, your total usage is going to go up. We've also worked very hard at looking at how farmers and vets estimate body weight of animals, and we tend to underestimate the weight of cows, and therefore we tend to underdose them. You correct that, you give more antimicrobials. So it's really important that the right dose is given to the right animal for the right duration, for the right disease, etc. And just measuring the amount used may not be such a good idea. But clearly that is what we have had to do, and that is what is being put upon us by our politicians. Though I used to think I knew where the politics of this was going in the UK, but all bets are off as far as UK politics are concerned at the moment. Right. Very quickly at the end, farmers are consistently positive about this. All right? The resistance tends to come from the vets. We know that those farms that use third and fourth generation cephalosporins tend to have ESBL resistance, so we've simply stopped using them, and that's where we are. All right, so it's about partnership, it's about teamwork, it's about, what I want to do is challenge you to go out, take this back to your practices, and we're working with large practices in the southwest of England particularly, and they're doing this and rolling it out into commercial practice, because I'm well aware that we could be criticised in saying, well, you're a small teaching practice, you're not representative of what's going on. But we can monitor these things, and we can embed it in how we manage the health and well-being of the herds. And this is quote from Edmund Burke that David Tisdall put into the presentation. I think it is appropriate because he's an Anglo-Irish politician from a couple of hundred years ago. But what he says here, nobody made a greater mistake than he who did nothing, because he could only do a little. And I think if you think, well, actually, I'm not going to change the world, how am I going to stop antimicrobial resistance? You're not on your own, but as part of a population, then, of course, that you can. Thank you for listening. Thank you for watching what is happening at the University of Bristol. We've got a huge amount of research going on in this area at the moment. And if we have time, if the chairman allows, I'd be happy to take a question or two.
So we'll have time for one question.
Need a microphone.
these systemic treatments that you mentioned, there were quite a number of systemic treatments, and was that all in the cows, or was it more in the calves and the young stock?
I think it will be predominantly in cows. You know, yeah. I have to put my hand up here, and this is I am presenting on behalf of the senior clinician in the practice. I don't work in the practice, and I knew if somebody was going to ask me specifically about what we're treating, I might struggle. But a lot of that will be you know, cows post-surgery, perhaps requiring antimicrobials, those kind of things.
Okay, thank you very
Okay.
much. That's all the questions, but I'm sure the speakers might be round afterwards if you want to chat to them during coffee. So thank you very, very much for the interesting presentation, David.